Hello everyone, I am Rohit Vats and you are watching Health Plus. Today we are with Dr. Man Mohan Mehndiratta, Senior Director, Neurology Department in BKL Max. Welcome to the show, Doctor.
Thank you so much.
So, Doctor, I was just wondering, how will you define what neurology is? What does it do?
Okay. Neurology is study of the nervous system. Now, nervous system is, you can say, in two parts: central, which runs in the center of the body, and then peripheral, where it comes out, goes up to the muscle. So it comprises of brain, the various, we call it as cranial nerves, like by the nerves called optic nerve, we see what we are see, and then we perceive, and it goes to the brain. Similarly, nerve of smell. This you must have heard during COVID. There is a lot of problem about smelling and taste also. So then there is a nerve of hearing. So like this, there are 12 cranial nerves. From the brain, the cluster of fiber goes down in our vertebral body called spinal cord. Like we say, he is my spine, like he is my strength. So spinal cord is like the nerve goes down, and then there comes from the various parts of the body roots outside. Then the root assemble together to make nerves. And nerve go on the muscle. Between the nerve and the muscle, there is a neuromuscular junction. So it's an extensive system, which is central nervous system, peripheral nervous system, controls all our body movements, programming of movement. If I am listening to you, I am first listening, I am understanding,
And then processing it.
I am processing, comprehending, and then to know what to respond, what to reply.
So basically, whatever you are functioning, whatever your body is doing, it's all controlled by the neurology department of the body. And I also wanted to ask, what all problems comes into neurological problem domain?
I think for general public it's very important question. The first and foremost I will say headache, epilepsy, Parkinson disease, forgetfulness, what we call dementia. These are the causes which are very common related to brain. Another important is stroke. Stroke is like brain attack. Everybody knows about heart attack, but brain attack not many people know. So in which paralysis on one side of body happens. Then we come to the spinal cord diseases and come to the nerve. With nerve there can be paralysis. And if there is a nerve muscle junction, myasthenia gravis. And if it is a muscle disease like muscular dystrophy. So these are commonest condition.
So these are different level of neurological disorders or problems,
Yes, sir.
including migraine.
Absolutely, absolutely.
So at this point, I would also like to ask you that what are the basic symptoms that we should be very aware of?
That's right. So if you are getting symptom, आपको पहली बार जिंदगी में कुछ हो रहा है, ऐसा सर दर्द हो रहा है जो कभी नहीं हुआ, like we say bolt from the blue, और catastrophic headache, vomiting शुरू हो गई,
एकदम बर्दाश्त के लायक
नहीं है, तो you must immediately consult the specialist. Similarly, suppose आपका फेस टेढ़ा हो गया, आपके एक हाथ में कमज़ोरी आ गई, आपको बोलने में मुश्किल हो रही है, तो इसको हम कहते हैं फास्ट फार्मूला FAST, जो कि स्ट्रोक का होता है, और उसमें इमीडिएटली आपको रश करना चाहिए हॉस्पिटल में. ये नहीं सोचना चाहिए कि मैं सो गया था, मेरा बाजू सोते हुए करवट में नीचे आ गया, so I had weakness. So it should not be there. It's a serious sign and you should rush to the hospital. Similarly, epilepsy is like if somebody is
लेकिन
moving
ऐसा
like
भी तो हो सकता है डॉक्टर कि एक सर्टेन ड्यूरेशन पर हेडेक हो रहा हो और हमने कभी उसको सीरियसली लिया ही नहीं.
जैसे माइग्रेन है, ये सबसे ज़्यादा कॉमन टाइप ऑफ हेडेक है वर्ल्ड ओवर, मोर कॉमन इन विमेन देन मैन. अब माइग्रेन आप कहोगे डॉक्टर कैसे डिफरेंशिएट करते हैं. कई पेशेंट आते हैं मुझे माइग्रेन हो गया, बट फिर भी हम पूछते हैं क्या है माइग्रेन, तो दे आर नॉट इन ए पोजिशन टू टेल एग्जैक्ट डिटेल्स. सो माइग्रेन में यूजली एक साइड, वन साइड हेडेक, थ्रॉबिंग हेडेक, लास्ट फॉर 4 to 5 hours, and there can be in addition some stars in front of eyes, and they feel miserable in sunlight and if there is a noise around. So this complex makes the criteria to diagnose migraine headache. Often women ignore it. They say it happened in kitchen because of the oil, because of the smoke, but it's not so. So they must consult and if there is some particular frequency, there are very good preventive medicine available, and also medicine available for the termination of the acute attack.
And how would you define epilepsy? Because a lot of Indian population, a good part of it suffers due to epilepsy.
Yes. Epilepsy, almost 1% of the population suffer from epilepsy.
जिसको मिर्गी भी कहते हैं.
मिर्गी भी कहते हैं. हम हिंदी में एक ही वर्ड है मिर्गी, पर एपिलेप्सी के बहुत टाइप्स होती हैं. एपिलेप्सी एक साइड में हो सकती है, पूरी बॉडी में हो सकती है. जो पूरी बॉडी में होता है, जिसमें हाथ पांव चारों हिलते हैं, आदमी बेहोश हो जाता है, मुंह से झाग आता है, जीभ कट सकती है, उसको हम जनरलाइज टॉनिक क्लॉनिक सीजर कहते हैं, या जो आपने अभी कहा कि मिर्गी कहते हैं. बट और बहुत टाइप के हैं. एब्सेंट एपिलेप्सी है, सिर्फ जर को बेहोश ना हो. एक है कि गुमसुम हो गए थोड़ी देर के लिए, ऐसे माउथिंग मूवमेंट हो रही हैं, तो वो एक डिफरेंट टाइप की एपिलेप्सी होती है. प्रॉपर रिकग्निशन बहुत ज़रूरी है. हम बहुत अप्रिशिएट करते हैं आजकल हमारे पेशेंट्स को. बहुत लोग आते हैं रिमोट एरिया से, विलेज से, सर हमने ना इसकी वीडियो बना ली. मेरी रिक्वेस्ट एक इस माध्यम से भी है टू ऑल दोज हु आर लिसनिंग और वॉचिंग, दैट यू मस्ट मेक what we call video capture of the event. Doctor is not there,
but they could understand the real time events.
Real time event, and we can see and then realize it is epilepsy or not.
Right. So you talked about epilepsy, you talked about migraine, you talked about general headache, which can turn severe at times. But apart from these things, there is Parkinson, and then there is dementia also, which are higher form of the same neurological disorder. How would you define those?
You all must be knowing about thyroid problem. Everybody says I am taking thyroid medicine.
Thyroid has become the new diabetes.
Like it is like diabetes, and they may be associated. So in Parkinson there is a chemical, or we call neurotransmitter, called dopa in the brain, in the deeper part of brain. So there is deficiency of dopa, and in that what happens, usually happens after the age of 60, though it can occur even before that. What are the symptoms? On one side, person is sitting and there is a tremor like this.
हाथ हिलता होगा.
हाथ हिलता हो, एक साइड या दोनों साइड. फिर उनके जो these steps have become like baby steps, and they walk slow. Their posture can become forward bend, and while walking they may freeze at one place. So this is called Parkinson disease, and there are many other mimickers, and I will say mimickers, and जैसे गिरगिट कहते हैं chameleons. So we need to differentiate, an expert can differentiate, and there are very good medicines for all types of problem which I am describing.
Is dementia similar to Alzheimer's?
बहुत लोग आके हमें कहते हैं, यंग पर्सन भी, कि मैं भूलने लगा हूँ. कई लोग बहुत स्ट्रेस में होते हैं, and they are not listening to the person carefully, they are not attentive, they are not registering, and say forgetfulness. That doesn't mean dementia. Or somebody is say depressed, he is sitting quiet.
By depressed you mean clinically depressed or just sad?
Clinically depressed or sad, and he doesn't take interest into surrounding. You ask him question, he doesn't answer. That doesn't mean he has dementia, but it's because of depression, which we call as pseudo dementia. All dementias are not Alzheimer. Dementias are of large type. There are number of conditions, and we say treatable dementia and relatively less treatable dementia. एक और आजकल आ गया rapidly progressive dementia, recent onset rapidly progressive. तो उसके causes बड़े different हैं and easily treatable. Can happen in thyroid disease, can happen in liver disease, can happen in kidney disease.
So liver and kidney disease can also lead to dementia?
Dementia, yeah. So those will be called metabolic dementia. While Alzheimer is because of degeneration of certain brain cells. Even in the field of Alzheimer, now there are very good treatments available. The main purpose is to stop it here. Sometimes there may not be cure, but at least control. And because of forgetfulness, if there are certain other symptoms which can be treated. One thing I like to highlight, there is very good diagnosis of dementia these days. Diagnostics in neurology has improved tremendously, and they can find out the blood circulation in the brain and what are the cells involved. Is it Alzheimer या कोई ऐसा है जो Alzheimer disease से मिलता जुलता है.
जब हम लोग न्यूरोलॉजिकल डिसऑर्डर्स की बात करते हैं तो हमको किस उम्र में लगातार रेगुलर स्क्रीनिंग के लिए जाना चाहिए और किन चीज़ों पर नज़र रखनी चाहिए, वो कौन से वाइटल पॉइंट्स
देखिए,
हैं?
neurological diseases can occur any time in life, but there are certain, like I will say stroke, even for dementia, like there are risk factors. What is required is lifestyle modification. If somebody is diabetic, if somebody is hypertensive, उनको स्ट्रोक होने का बहुत हाई रिस्क है. स्मोकर है, अल्कोहल लेते हैं, उनका कोलेस्ट्रॉल हेवायर है, तो उनको स्ट्रोक होने का काफ़ी रिस्क है और इन सब को हम प्रिवेंट कर सकते हैं. सो इसी तरह से डिमेंशिया का है. इफ़ वी आर कॉग्निटिवली एक्टिव, जैसे आजकल सोशल मीडिया है. अब सोशल मीडिया में मैं नाम भूल गया, रोहित जी मेरे से मिले थे, पर जैसे आपका व्हाट्सएप आएगा या कुछ फिर मुझे याद आ जाएगा. सो इट्स ए मैथमेटिकल. इन द ब्रेन द सेल्स गेट रिजुविनेटेड एंड रिमेंबर अगेन. So it is said that those people who are better educated are less likely to have Alzheimer's disease.
Because they have a process to
Yeah.
recall something.
Yes. Mathematic calculation, remaining active, reading all the time. If you are reading today one newspaper news, then you will recall that, oh, yesterday also there was some news like this.
Right.
So that is like reactivating your brain cells.
So basically, the more pressure you put on your brain early in life, it can help you later.
Not pressure, but enjoy.
I meant it that way. So coming back to those signs and symptoms, what precautionary measures, what lifestyle changes we should go for to prevent things like, say, migraine or headache later in life, or even when you are young?
See, migraine main is, if you are having it, I will say migraine is often under-recognized, under-diagnosed, under-treated, sometimes wrongly diagnosed.
हमको पता ही नहीं है कि migraine.
So, एक तो जब कभी सिम्टोमेटिक हो तो बहुत अच्छी ट्रीटमेंट अवेलेबल है. सपोज यहाँ सर दर्द शुरू हो रहा है, ऐसे जा रहा है, तो यहीं पे दवाई लेनी है. ये नहीं करना जब बढ़ जाएगा, then I will take painkiller, specific painkillers are there. So then it may not come down to the extent your day is lost.
This happens a lot in migraine and also in epilepsy.
Yes, sir. If days are lost, then your Monday is gone, your office work suffers, your family suffers. Similarly, for epilepsy, we call it a termination of seizure. So जैसे ही हो रहा है, आजकल हम दवाई देते हैं जीभ के नीचे रखने के लिए, कि वो घर में हो रहा है, डॉक्टर को नहीं बुला सकते, तो आप जीभ के नीचे रखिए. That's what I call as semi injection. Similarly, there are now spray, nasal spray. अगर किसी को होता है, आप रखिए, नोज़ में स्प्रे कर दीजिए, उससे वो टर्मिनेट हो जाएगा. वो बहुत ज़रूरी है इससे पहले कि वो बड़ा दौरा बने. As we are saying that India is the capital of diabetes. More and more young people are getting diabetes. And diabetes can affect whole nervous system. In the brain, it can cause memory loss. It can cause clots or stroke. If they are too many stroke, it can lead to forgetfulness. Similarly, diabetes, most common problem which is found is effect on the nerves. Now, some people say, I have diabetes, my sugar is 200, I have no problem. Problem doesn't come every day. The complications come after 5 years. On heart, on kidney, on the nerves. They say, we feel as
it will keep accumulating and then one day you will suffer.
It's a toxic effect, no? It's a silent toxin. So there is a tingling in the nerve, numbness in the hands. I cannot walk. In the evening, if I close my eye, I tend to fall down. So this is called diabetic neuropathy. Very common complication.
Which happens every day with diabetics.
Yeah, and some people may have एक ऑटोनॉमिक नर्वस सिस्टम होता है, अगर वो इन्वॉल्व हो जाए तो उससे सडन कार्डियक डेथ हो सकती है. सो वन हैज़ टू बी केयरफुल. एंड इन डायबिटीज़, too high blood sugar, I will not say high blood sugar, too high blood sugar is dangerous and too low blood sugar is also dangerous. So you have to maintain a balance and remain under the guidance of a good doctor.
One more thing that I wanted to understand from you, कि न्यूरोलॉजिकल डिसऑर्डर अगर कुछ हो गया, कोई बीमारी अगर हो गई, तो उसके बाद भी कोई बहुत डरने की बात नहीं है. ट्रीटमेंट और थेरेपीज अवेलेबल है.
एक टाइम था जब कहा जाता था दैट इन न्यूरोलॉजी इट्स ए पैसिव ब्रांच. इट्स नो मोर ए पैसिव ब्रांच, इट्स वेरी एक्टिव ब्रांच. देयर आर लॉट ऑफ नाइस डायग्नोस्टिक टेस्ट अवेलेबल और हमारा हमेशा अटैम्प्ट रहता है जितना नॉन इन्वेजिव टेस्ट कराएं, और आजकल एडवांसेस बहुत हो गए हैं, जैसे आपने एमआरआई सुना होगा। सिमिलरली एमआरआई के बियॉन्ड भी बहुत सारी चीज़ें हैं। पार्किंसन डिजीज में एक एफ डोपा स्कैन होता है, तो पता चल जाता है पार्किंसन है। अर्ली पता चला, ट्रीट किया, पर्सन लिव लॉन्ग लाइफ। नाउ अर्ली डायग्नोसिस, अर्ली डिटेक्शन, early treatment, you are seeing how life expectancy is increasing.
Right.
So that's very helpful. But जो कहते हैं ना, we have to be aware, या एक कॉमन जो लैंग्वेज में कहते हैं, हमें सजग रहना है, and nice diagnosis and treatment are available.
On that hopeful note, thanks a lot for your time, doctor.
Thank you. I appreciate.
We will soon come up with another expert in another episode. Till then, thank you.